Today, let's learn about interpreting blood test results. In part 1 of today's session, I will teach you how to interpret results for red blood cells and platelets, including the different types of red blood cells. In today's session, we will also cover a new blood parameter for Crystal Pet Animal Hospital called reticulocyte Y, or RET-Y for short. There is also a section on white blood cells, but we will discuss that in the next part. Part 1 will primarily focus on red blood cells. On the current page, we have two types of RBC measurements: normal RBC, which is unmarked, and RBC with an O marking. The unmarked RBC is measured using impedance, which is an electrical impedance method. The RBC with an O marking is measured optically using flow cytometry and fluorescence channels. Most labs, 99.99%, use RBCI because it is easier to measure. However, for research purposes, RBCO is preferred because the optical method via flow cytometry is much more accurate. In cases of coagulation or autoimmune conditions, such as IMHA, immune-mediated hemolytic anemia, MCH values can be unusually high, sometimes reaching 70 to 80. This can lead to a lower RBCI value than the actual count. Remember that hematocrit, hemoglobin, MCV, MCH, and MCSC are all measured using the impedance method. So if RBCI is inaccurate, all these values will be off as well. Therefore, researchers and blood specialists prefer to use RBCO for more accurate results. In dogs, normal red blood cell counts range from 5.5 to 8.5. The second parameter is hemoglobin, which is responsible for oxygen transport. The third parameter is hematocrit, which measures the packed red cell volume. The issue with hematocrit is that it must be interpreted in conjunction with MCV, because deviations in MCV can cause inaccurate hematocrit readings. If MCV is low, hematocrit will also appear low, and if MCV is high, hematocrit will appear high. If veterinarians still use the traditional method from 30 years ago, where the exact red blood cell count was not available, they must check if MCV is within the normal range before relying on hematocrit values. Normally, hematocrit is approximately 3 times the hemoglobin value, but modern devices can calculate it more accurately. The significance of these parameters, RBC, hemoglobin, and hematocrit, is that they are used to calculate MCV, MCH, and MCHC. The challenge for veterinarians is understanding the importance of monitoring MCV, MCH, and MCHC, and how these values impact their interpretation of blood tests. Let me explain it simply. MCV is the size of hemoglobin in red blood cells, or mean corpuscular volume. Do you see its unit? It's written in femtoliters. Femtoliters are used to measure the volume of hemoglobin in the overall red blood cells. Therefore, it is averaged over the volume of red blood cells over 120 days. I use the term overall because it is calculated from the existing red blood cells, which have a lifespan of 120 days. Therefore, MCV is calculated by multiplying hematocrit by 10 and dividing by RBC, red blood cell count. The unit is liters, indicating volume. The second parameter is MCH, or mean corpuscular hemoglobin. MCH is measured in grams, indicating weight. MCH is calculated by multiplying hemoglobin by 10 and dividing by RBC, representing the average weight of hemoglobin in red blood cells over 120 days. OMCHC, or mean corpuscular hemoglobin concentration, can be remembered easily. It is calculated by dividing MCH by MCV and then multiplying by 100. This means comparing the weight of hemoglobin to its volume in red blood cells. To visualize, MCHC is like comparing a person's weight to their height. For example, if you are 175 centimeters tall, your ideal weight is a certain value. If you are overweight, MCHC will be higher, such as 36, 37, 38, or 39. When you're overweight, red blood cells can break down. This is an easy way to remember. When teaching patients, ourselves, or junior colleagues, we can understand why we look at these three values. MCV measures volume. MCH measures weight. MCHC compares weight to volume. Understanding these values helps determine if a patient is too fat or too thin. For instance, if MCHC is high, it was traditionally believed that it indicated red blood cell breakdown due to alcohol contamination during blood sampling. In reality, MCHC over 36 is mostly due to sudden fear or panic in animals. Causing rapid heartbeats and red blood cell breakdown. This excludes conditions like IMHA, where red blood cells already break down significantly. Understanding these points can help veterinarians better explain blood test results to the public and provide more accurate care for animals. Let's move on to the next parameter, RDW. We'll set aside blood storage for now. RDW, or red cell distribution width, measures the variability in red blood cell size. Normally, we look at RW as CV, coefficient of variation, rather than SD, standard deviation, because CV is easier to interpret. It is the opposite of platelet distribution. For RWCV, if it's within the normal range, we consider it stable. If there is no new red blood cell production, RDW tends to be low. Personally, I consider an acceptable RDW to be no higher than 16, with an absolute maximum of 18. Currently, we know that high RDW is associated with shock or even mortality, indicating that RDW is linked to heart and overall body pressure conditions. RDW is used in conjunction with parameters like reticulocyte production index, RPI. Traditionally, it was believed that during regeneration, MCV would increase, MCHC would decrease, and RDW would increase. However, this is not always true. Think about it. If this traditional theory, taught for over 30 years, were accurate, it would always hold true. But it doesn't. The limitations of older methods, which couldn't measure RBC or reticulocytes accurately, explain this discrepancy. MCV is calculated by multiplying hematocrit by 10 and dividing by RBC. If a dog has only 4 million RBCs, instead of the usual 8 million, the MCV will naturally increase because it's divided by a smaller number. Thus, MCV increases if RBC count drops due to blood loss. And as a result, MCHC decreases because MCHC is derived from dividing MCH by MCV. When MCV increases, MCHC must decrease, because the MCHC value is calculated by dividing MCH by MCV. When MCV increases, MCHC must decrease. You see, the basic theory is flawed. It's just an old-fashioned idea from ancient doctors who believed that when blood loss occurs, there must be an increase in the production of immature red blood cells, leading to greater distribution and larger size because the cells are bigger. While it's not incorrect, it doesn't always mean that it's regenerative anemia. Therefore, if we go back to the RDW value, it's not necessarily true that RDW must increase when regenerative anemia occurs. There are many factors that can cause RDW to rise. Is it possible that there is increased production of immature cells? Yes, partially. Could there be high blood pressure? Yes, that's related. Could it be a sign of impending heart failure? It could be. Therefore, when interpreting these results, we need to consider and keep up with modern advancements, because blood test technology has progressed significantly. Moving on from RDW, let's talk about reticulocytes. In the past, we couldn't measure them or stain them clearly. Therefore, pathologists had to use a microscope, classifying them into two categories, R-gate and punctate, with R-gate coming first and punctate following, eventually becoming RBCs. Normally, reticulocytes in dogs take about 3 days to transform into RBCs. But in cats, it takes 14 to 21 days. Hence, when administering drugs to stimulate red blood cell production in cats, the response isn't as quick as in dogs. It's important to understand that different species have varying sensitivities in their production rates. For reticulocytes, we divide them into 3 categories: H, M, and L. If you add H and M together, it results in IRF, immature reticulocyte fraction. What does HML stand for? H stands for high fluorescent reticulocyte, M stands for medium, and L stands for low. H refers to very immature cells that stain heavily with fluorescent dye. M stains moderately, and L stains lightly. Combining H and M gives us the IRF, which stands for intermediate reticulocyte fraction. IRF, the intermediate reticulocyte fraction. This value is significant. If there are a lot of immature cells, H and M values will be high, resulting in a high IRF. If it exceeds 40, it might indicate regenerative anemia, but not always. You need to consider other related values, such as a high number of fragmented RBCs, which can affect the reading, or conditions like autoimmune diseases. Therefore, a high IRF doesn't necessarily mean regenerative anemia. There's also a newer parameter called RET-he, reticulocyte hemoglobin equivalent, which has been around for about 10 years, but is still not well understood among Thai veterinarians. RET-he is significant and related to MCV and MCH values. RET-he is the hemoglobin in reticulocytes. If RET-he is low while MCV is normal, it might indicate that the animal has been nutrient deficient. 3 days for dogs, 14 to 21 days for cats. Since the lifespan of a reticulocyte in dogs is 3 days, if the RET-he, reticulocyte hemoglobin equivalent, is too low, it indicates that the dog has been iron deficient over the past 3 days. However, MCV and MCH are averaged over RBCs that are 90 to 120 days old. This allows us to determine if there have been dietary changes over the past 120 days, or if the dog has been eating less or experiencing chronic inflammation in the last 2 to 3 days. As you can see, the RET-he value is quite significant. When you get the RET-he value, there's another related value called RBC-he, RBC hemoglobin, which is analogous to MCH. RBC-he is derived from measurements in the reticulocyte channel using scattergram analysis. Unlike MCH, which is based on impedance graphs. Although RBC-he is close to MCH, it is more accurate. Subtracting RET-he from RBC, he gives delta-he. Delta-he has significant implications. If delta-he is positive, it suggests that the animal is not iron deficient, because reticulocyte hemoglobin is greater than RBC hemoglobin. indicating sufficient iron for blood production. A negative delta He might indicate chronic inflammation. As the body sequesters iron within liver cells during inflammation, controlled by hepcidin. During surgeries or significant injuries, iron levels can drop sharply if blood is lost. But normally, broken down red blood cells are stored in the liver and reused for new red blood cell production. Unless you lose blood, such as through surgery, severe injury, or menstruation, where iron is lost from the body, the values will drop significantly. However, under normal circumstances, when red blood cells break down, they are stored in the liver and tissues, and then recycled and reused to produce new immature and mature red blood cells. Therefore, during inflammation, delta E tends to be negative, indicating that the body is storing iron and not utilizing it. Each value has its meaning. Another value related to this context is NRBC, nucleated red blood cells. What is NRBC? NRBC stands for nucleated red blood cell. And this term is significant because NRBC values often increase in various types of cancer. Particularly in many cancers, if there are issues with the spleen, including blood parasites, or if the spleen is removed, NRBC values will rise. This is one important aspect. Next, let's look at hyper-He and hypo-He. Hyper-He. This refers to the elevated levels of the overall red blood cell population in the reticulocyte graph, indicating the presence of larger red blood cells. These are known as hyper-He. Hypo-He. Conversely, if the RBC population shifts downward, it is referred to as hypo-He. Hypo-He indicates iron deficiency. Apart from iron deficiency, hypo-He can also indicate kidney dysfunction. Conditions such as cysts or kidney stones, which impair kidney function, can lead to hypo-He. International kidney disease institutions use this value to assess and analyze kidney diseases. Now, let's discuss fragmented RBC or FRC, also known as schistocytes. These are fragmented red blood cells, which are significant because they can occur in conditions like IMHA, immune-mediated hemolytic anemia, and various other disorders. If the level of fragmented RBCs is higher than normal, it can indicate the presence of tumors. Why is this? Normally, red blood cells travel through blood vessels to nourish different cells. However, when they pass through capillaries that supply blood to tumors or cancers, which are very small, they may deform and break. Normally, red blood cells can slightly change shape to pass through small capillaries, but when passing through extremely small vessels in tumors or cancers, they collide and break apart. Therefore, a high FRC value can indicate the presence of tumors. Let's move on to the new RET-Y value. Let's first understand what RET-Y is. RET-Y is actually measured in the scattergram channel for reticulocytes, as shown in this diagram. Simply put, it is similar to reticulocyte volume. Why is it important? let's take a look at the graph and our blood test results. Ret-Y in dogs is approximately 150, while in cats it is around 100. Why is this important? When we administer iron to animals suffering from iron deficiency, such as those with IDA, iron deficiency anemia, Ret-Y levels will increase within about 2 days. Ret-Y is correlated with Ret-E values. Therefore, if an animal has IDA or any condition causing iron deficiency, both Ret-Y and Ret-E levels will decrease. Let's discuss the relationship that I will review for you. When red blood cells are depleted or lost, the body needs to produce reticulocytes to compensate. Reticulocytes are larger than mature red blood cells. Traditionally, under a microscope, reticulocytes are classified into aquigate and punctate. However, with modern blood testing equipment, we categorize them as HML high, medium, and low fluorescent reticulocytes. These classifications are important because an increase in reticulocytes indicates a response to the loss of red blood cells. The result is an increase in RBC count. If this increase actually occurs, then MCV will change accordingly, and RDW will also rise. When red blood cells decrease, what happens to MCV? The divisor increases, causing MCV to decrease. This is the pattern you will see. However, I must emphasize that the production must be real. You can't rely on old theories and assume that regeneration will always occur. You need to consider various factors together. This is just to give you an understanding of the mindset of the old versus the new approach. When blood loss occurs, within 2 to 3 days, reticulocytes are produced. Reticulocytes are larger. So what happens when there are more large reticulocytes? The overall red blood cell size increases. Therefore, when reading a red blood cell graph, we always read from right to left. Why? Because you start with the larger cells and move to the smaller ones. The smaller cells eventually become fragmented RBCs. So, when interpreting blood results, we read from right to left on the impedance graph. When reading the graph of the reticulocyte channel, we read from top to bottom. Why? Because you start with the larger cells and move to the smaller ones. And what are these? Fragmented RBCs, right? We will discuss this palette later. Therefore, everything we see is interconnected. Newly produced immature red blood cells from day 1, day 2, and day 3 are large. They start as a loose population and then begin to break down around day 80 to day 120. You see, this is how you read the blood results to understand them better. Let's talk a bit about platelet counts, specifically platelet F, where F stands for fluorescent. Nowadays, platelets can be tested and detected in 3 ways. I, impedance, O, optical, and F, fluorescent. The more accurate values we accept are from O and F, with F being the most accurate. When using platelet F, we can detect values like IPF, which stands for immature platelet fraction, indicating the presence of immature platelets. Regarding platelet values, traditionally, every doctor memorizes that normal platelet counts are between 200,000 and 500,000, or according to some references, between 105,000 and 400,000. In reality, platelet counts are individual-specific and even breed-specific. For instance, Shiba Inus and Akitas often have counts in the tens of thousands, like 40 or 60, sometimes not even reaching 100,000. This is also true for Cavalier King Charles Spaniels, where 50% of them have low platelet counts. We haven't even discussed why Cavaliers with low platelet counts are prone to heart disease. I'll make a separate clip explaining the relationship between Cavaliers, IPF, and heart disease. If you can choose, it's best to get the platelet count using the O method, and even better, the F method. When we obtain this platelet count, it's similar to red blood cells, including values such as PDW and MPV. PDW, or platelet distribution width, measures the variation in platelet size. As mentioned, PDW is opposite to RDW. While we look at RDW as a percentage, we measure PDW in femtoliters. This difference makes it more detailed and easier to understand. Therefore, normal platelets tend to be relatively small, with a PDW acceptable up to 18 femtoliters. For instance, in this case, the PDW is 13.5, indicating that this dog has no significant platelet loss. MPV, or mean platelet volume, represents the size of the platelets. The normal range for dogs is 9 to 13, although some references may consider 5th August 2013 acceptable. This dog has an MPV of 10.5, which is within the acceptable range. PDW should not exceed 40% for both dogs and cats. If PDW is high, it indicates the production of large, immature platelets. Immature platelets, or IPF, are larger in size. Therefore, the platelet large cell ratio, or giant platelet count, typically includes both giant and immature platelets. However, modern equipment can distinguish between these, separating IPF from giant platelets. Simply put, IPF, immature platelet fraction, contains granulocytes, which release serotonin, affecting heart disease. In contrast, giant platelets do not contain granulocytes. Platelet kit refers to packed platelets. For example, this dog has a count of 262, meaning 262,000 platelets. Since the MPV, mean platelet volume, is slightly above 9 or 10, the platelet kit thickness increases slightly, resulting in a value of 0.30. If this dog's platelet count were 120,000, with an MPV of exactly 10, the platelet kit would be approximately 0.12. This is a rough estimation of the platelet kit. At this point, we need to focus on the IPF, immature platelet fraction. When evaluating IPF, we look at it from two perspectives. Why two perspectives? The absolute value of IPF, if very low, can indicate bone marrow failure. How does platelet discussion lead to bone marrow? Because the bone marrow takes just 2 to 3 days to produce platelets. So if it's not producing them, it means the bone marrow is failing. Bone marrow failure and bone marrow suppression are different issues. For dogs, if the IPF exceeds 5%, for cats, it can range from 6% to 13%, up to 20%. It indicates bone marrow suppression. This could be seen in cases of autoimmune diseases and other conditions. Therefore, in my practice, when I see a platelet count of 262,000, the first thing I check is the IPF. If the IPF is 5% or higher. In this case, the IPF is 2.4%, which is below 5%. This indicates that the platelet count of 262,000 is the normal platelet count for this particular dog. Let's review. If we focus solely on the red blood cells, platelets, and reticulocytes in this case, how would I interpret the blood results for this dog? And how do I approach this? Experienced hematologists first look at the graph, not the numbers. This means that if you are truly proficient in interpreting blood results, you should always include the graph in your analysis. Let's take a look. The first thing I would check in this case is the graph. Looking at the RBC graph, it starts at 0, rises, and then falls back to 0. Therefore, I can confidently say this is not coaccidentation. The shape is quite smooth, indicating normal production. Let's consider the platelets. The platelet graph should start at 3 femtoliters, rise, peak, and then fall to the lowest point before transitioning to RBCs. This pattern indicates that the blood count is likely normal. When we look at the graph, the first thing we need to do is count. For dogs, it is on the 3rd line in the middle of the RBC graph. For cats, it is on the 2nd line. They are different. In the IDEX ProCyte DX machine, they multiply by 2, which corresponds to the 6th and 4th lines. After seeing this graph, what do I check next? I look to see if there are any fragmented RBCs and if the platelet count is normal. For dogs, this is on the 3rd line. How does the RBC look? Is it normal? For instance, in the case of hypohe, if it drops down, the overall distribution will move downwards. Normally, it should be on the 3rd line, which we refer to as hypohe. If it rises upwards, we call it hyperhe. For platelets, this indicates fragmented RBCs. The green represents IPF, or immature platelet fraction, while the other part indicates normal platelets. Now, let's interpret the results, focusing only on red blood cells and platelets. For this case, normal RBC counts in dogs range from 5.5 to 8.5. Therefore, for normal RBCs, I mainly look at O because it is more accurate. Hemoglobin, which carries oxygen, should be between 12 and 19. Packed red blood cells, hematocrit, should be between 35 and 55. If MCV is below 60, it indicates iron deficiency, and if it is above 77, it indicates folate deficiency. In this case, the MCV is 67, which is normal. The unit for MCV is liters, and for MCH, it is grams. As mentioned, MCV is volume, and MCH is weight. When I divide 22.7 by 67.5 and multiply by 100, I get 33.7. This indicates that this dog is not scared. and there is no evidence of red blood cell fragmentation during transfusion. The platelet count is 262,000. Upon seeing the platelet count, what do I do next? I immediately check the IPF, which is 2.4. Since the IPF is not more than 5, it shows that this dog's normal platelet count when healthy is 262,000. The RDW is 14.3, indicating that the dog is not very anxious. However, I need to look at the RPI, reticulocyte production index, next to see if it exceeds 1. In this case, the RPI is 0.6, which means I can rule out heart disease, fear, and excitement. This dog definitely does not have high blood pressure. This demonstrates how you can infer the dog's condition and behavior from the RBC and other CBC values. If NCSC, nucleated cell suspicion coefficient, rises above 36, it indicates that the dog is scared during the blood draw, but it does not necessarily have heart disease. Would cause high blood pressure only if RPI, reticulocyte production index, or RW, red cell distribution width, is abnormally high, or if one specific value is elevated. In this case, the RDW is 14.3, indicating that the dog is not producing immature red blood cells. This means the dog is normal, not non-regenerative. It simply doesn't need to produce more red blood cells, because it already has 7 million, which is its individual limit. Therefore, the dog does not need to produce additional red blood cells, which explains why there is no increased reticulocyte production. The platelet count is 262,000. PDW should not exceed 18. MPV should not exceed 13. And the platelet large cell ratio should not exceed 40. This indicates that the platelets are normal in both quantity and quality, with no significant loss or destruction of platelets. Thus, the platelet count is perfectly normal at 262,000. As previously mentioned, the normal reticulocyte range in dogs is 0 to 1. This dog has a value of 0.38. This value can be divided into 3 stages, H, M, and L. Since the IRF, immature reticulocyte fraction, is not above 40, does this mean the dog is non-regenerative? It has reached its optimal level. The reticulocyte count is 24.2, so 24.2 needs to be checked against MCV and MCH to see if they correlate. Typically, if the reticulocyte count is around 23, the MCV is about 60. Therefore, with a reticulocyte count of 24.2, an MCV of 67.5, and an MCH of 22.7, this dog does not have an iron deficiency. When we subtract RBCP of 23.6 from 24.2, we get a positive delta of 0.6. This indicates that the dog appears perfectly normal from the outside. Even if there might be internal inflammation, a positive delta still means the dog is overall healthy. Next, the NRBC, nucleated red blood cells, value is 0.02. which is within the acceptable range, but ideally should be 0.00. A slight presence of NRBCS is not serious and might suggest some red blood cell production. However, in this case, there is no production of immature red blood cells. In this case, I already know that it's my own dog, and he has a slight splenomegaly. This means that the RBC count is affected. Don't assume that RBC should be higher for it to be normal. As someone who works with these values daily, I know what is normal and what isn't. Is 0.02 serious? No, I'm not worried. What does NRBC look like? It resembles lymphocytes, which means that standard machines might incorrectly count NRBCS as lymphocytes and include them in the total white blood cell count, WBC. Therefore, the total nucleated cell count shows as 13.51. because it adds the actual WBC count to the NRBC count. Standard machines, not high-end ones, can't differentiate NRBCS from WBCs, which can lead to inaccurate counts, particularly in cases of blood cancers. Now let's look at hyper and hypo. The hypo He value is 0.4, which is below 1. This indicates that the dog definitely does not have kidney disease. I can say with almost 100% accuracy that this dog does not have kidney disease if hypo He is below 1. This is because there is no iron deficiency. The dog can still store and utilize iron normally. Therefore, this case is not indicative of kidney disease. Additionally, the balance between iron and folic acid/B12 is quite good, with a ratio of 0.3 to 0.4. This is very good and indicates a well-balanced state. This matches what we saw on the graph earlier, indicating normalcy. Fragmented RBCs were found at just 0.02, which is very minimal. Therefore, there's nothing concerning in this case. The normal RET-Y value is around 150, give or take a bit. At 149, it's considered normal. For dogs, the RET-Y should ideally be 150 or above, and for cats, around 100. So in this case, we need to check how the reticulocyte graph trends downward. You see the expected range for reticulocytes, right? For dogs, it should be between 2.5 and 3.5. But you notice the trend in the reticulocyte levels is declining. This indicates that while the dog isn't currently iron deficient, it might soon become iron deficient because it's producing a significant amount of red blood cells, approximately 7 million. Therefore, it would be beneficial to supplement with a bit of iron. This will help maintain optimal health in this case. In summary, RBC He is measured similarly to MCH. But it is done through the reticulocyte channel. I mention this because in the past, there were some misunderstandings about this. Through further study, I've clarified this and explained it to both senior and junior colleagues. This concludes part 1 of interpreting blood test results, focusing on red blood cells, platelets, and reticulocytes. We've been discussing this for almost 50 minutes. I did make a small error when talking about NRBCS. But I hope the information provided has been helpful. If you listened all the way through, you likely gained some useful insights and can now apply this knowledge to interpret blood tests for various animals. I will interpret the results for white blood cells. White blood cells have aspects like S-limb and L-limb, which I've already mentioned. We'll also discuss CTC and HFLC in the WNR channel. CTC are particularly interesting, as well as SIC, which stands for severe inflammatory cells. These values can indicate cancer, tumors, or certain inflammations. I will cover these topics in the next part, as this part alone has already taken 50 minutes. Thank you for listening until the end. I believe there may not be many listeners, but I want to create these videos to show that Thai veterinarians can interpret blood tests proficiently. If you understand my explanations, you'll see that this knowledge is quite advanced and not from 30 years ago. All the values are interconnected. Please follow my other videos where I interpret blood tests, as this one covers the basics of RBC, platelet, and reticulocyte interpretation. Thank you, and goodbye.